Hey, Scott, the other thing I was going to do.
Good morning, everyone. Who's ready for a meeting? All right, we're ready. So I'd like to welcome you all to the Southern Nevada Health District Board of Health on June 25th, 2026. I'll call this meeting to order and ask for help with the roll call.
Member Becker? Chair Black?
Here.
Member Bond? Here. Member Burney?
Present.
Member Gallo?
Here.
Member Hardy? Oh, he was on. It looks like he dropped off. Member Kirkpatrick?
Here.
Member Larson?
Here.
Member Nemec?
Here.
Member Nielsen?
Here.
And Member Summers Armstrong.
Present.
And I'll see if Hardy is back on. He is not. We do have quorum.
Okay, thank you very much. If you will all join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Now we have the opportunity to recognize some incredible employees for the good work that they do and the recognition that they deserve for their efforts. First, I'd like to read this to you. It's pretty extensive, so hold on tight. In late May, the Southern Nevada Health District hosted a 2-week CDC EPI AID investigation focused on overdose prevention in the Clark County community. Overdose-related mortality in Nevada, while declining more slowly than in other states, remains a significant public health crisis. This investigation represented a critical opportunity to collect robust mixed method data that will inform future strategies to better prevent overdose across the state. The success of these high-stakes, compressed timeline effort depended entirely on a team of SNHD staff who volunteered their time, energy, and expertise on top of their existing full workloads. These staff members went above and beyond their regular job duties to ensure the EIS officers could conduct their work effectively and that every community member and partner felt supported through the process. The culminating product of this effort is a comprehensive report summarizing findings and recommendations for reducing overdose in Clark County. This will be used to inform future public health strategies at the local level. The work done by this team during those 2 weeks will have a direct and lasting impact on how Clark County addresses one of its most pressing health crises. We would like to recognize these exceptional employees and the CDC team. From SNHD, our team consists of Jason Agudo, Victoria Burris, Belen Campos Garcia, Rebecca Cruz Nanez, Brandon DeLise, Tabby Edelman, Tiffany Flournoy, Victoria Hughes, Jessica Johnson, Dr. Lockett, Dr. Mengele, Marco Mendez, Sandy Sato, and Lee Zhang. So let's hear it for these amazing employees. Are there any individuals from the CDC team here, or have they moved on with their lives? Just kidding. Yeah. So I'm going to read their names as well. Dr. Dominique Hargrave, Dr. Irina Kasarski, Dr. Chelsea McCullough, Dr. Jeff Melly, Dr. Joy Ortega, and Dr. Hallie Riley. We will take a photo with these awesome individuals here in a moment, but now we would like to recognize our June employees of the month. Where's Kayla Penska? Is Kayla here? Hey, Kayla, way in the back. Kayla is a digital content specialist in our communications department. And where's Jessica Umel? All right. Jessica is a community health nurse in our primary care and preventive care division. Each month we recognize those individuals that go above and beyond for the health district and our community and best represent our care's values. And so we're very, very thankful for these two amazing employees and want to recognize them today. And then lastly, we would like to recognize two phenomenal individuals who are our manager and supervisor of the quarter. These two individuals I have known for a long time, so I'm going off script. They are real staples and part of the backbone of the health district in their respective areas of expertise. And I hear that they're moving on to bigger and perhaps not so better things, because it doesn't get much better than SNHD, but that's subject to the debate. So I want to congratulate these two for, I think they're about ready to retire. But without further ado, let's recognize health Health Education Supervisor in the Community Health Division, Nicole Bungum. Where's Nicole? Stand up, Nicole, come on. Oh, all right, we'll put eyes on Nicole in just a minute. And also, where is our Environmental Health Manager in the Environmental Health Division? None other than Carla Shoup. All right. So back to the script. Each quarter, 2 individuals are selected and as nominated by staff to recognize leadership, teamwork efforts, ideas or accomplishments, and best represent our CARES values. And again, as the Board of Health, we have an incredible team of employees, and it's an honor to recognize these 2 amazing managers and supervisors for their dedication over several decades to the community that they serve. So let's go take some photos with our first group, the people that helped CDC for the 2-week project, and then we'll photograph together with our employees of the month and manager supervisor.
Mr. Chair, if you don't mind, I'd like to just give a little extra shout out to both Nicole and Carla because I personally worked with them long before I was even on the health board. But they truly have really always been a staple of the health district and all the extra stuff. And I'm sad to see them go, but I remember Nicole when her daughter was about 7. Now I think she's headed to college. And family time is really what people should adore. And I'm sure that Carla won't miss one more season of pools, but really, you've done yeoman's work with the health district. And I personally am going to miss you because I do a lot of things with both of you. But good luck and please enjoy your your retirement. But you still have time, so you're going to be here a while. So.
Carla will probably never swim again. But it's okay. It's okay. All right, let's get into this agenda here. So now we will go to before we go to first public comment, we are going to change one agenda item, the order of things. We will go through the agenda as published to hear item number 8. At that point, we will recess and go into closed session. After we come out of closed session, we will resume our agenda at we're going to go to item number 8, number 1, then we will recess, and then we'll come back to 8.2 and proceed to the end of our agenda from that point on, if that makes any sense. All right, so with that, I will open up the first public comment, a period devoted to comments by the general public about those items appearing on the agenda. Comments will be limited to 2 minutes per speaker. Please clearly state and spell your name for the record. If any member of the board wishes to extend the length of the presentation, this can be done by the chair or by board majority vote. The time is now yours. If you have something you'd like to say regarding posted agenda items, now's the time. Seeing no one coming forward, do we have any written comments or anyone on the in cyberspace?
No, I haven't received any written ones, and there's nobody online for
Okay,
public
thank you.
comment.
With that, we'll close the first public comment. Go to item number 4, adoption of the agenda. The chair will entertain a motion to adopt the agenda as modified or amended. Would that be appropriate, Heather?
Yes, thank you.
Okay.
I'll move for approval of the agenda as amended.
We have a motion and a second. All in favor, say aye.
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 Any opposition? For those board members joining us virtually, if you'll state your name along with any opposition, if that is applicable, that motion passes and the agenda is approved. Now we'll go to item number 6. Consent agenda consists of 3 items. If there are no comments or questions from the board, I will entertain a motion to approve the consent agenda.
Second.
We have a motion and a second. All in favor, say aye.
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 Any opposition? Hearing none, that passes. Now we will go to section 7, public hearing action. Number 1, petition 36-26, approve and authorize the district health officer to sign general and supervisory units, collective bargaining agreements, CBA, both to be effective upon approval by the board as follows. A, 5% cost of living adjustment COLA in FY27, 1-step increase in FY27 for those who have not reached the final 14th step of the salary schedule. B, 3.5% COLA in FY28, 1-step increase for FY28 for those who have not reached the final 14th step of the salary schedule. And C, Article 20 will be opened for FY29. This is a public hearing. At this time, I'll open the public hearing for any individuals that would like to speak regarding this agenda item.
Chair Black,
Yes.
if you want to hear from Renee Trujillo, she is also available, our Chief Human Resource Officer.
Okay, that would be awesome. So if there are no one coming forward during the public hearing, I'll close the public hearing and invite Renee to come forward and speak to this agenda item and the process that led us here. Oh, there was a D also, extend the same financial changes to non-union employees not covered by the SEIU general or supervisory collective bargaining agreement and direct staff accordingly to take other actions as deemed necessary. Good morning. Thank you for being here.
Good morning. For the record, Renee Trujillo, Chief Human Resource Officer for SNHD.
Good morning, Jason Klum, Chief of Staff for SEIU Local 1107.
Good morning. I don't know if you can hear me. Oh, yeah, you can. Sandy Leckett. I am part of the bargaining team and a almost 22-year member of SNHD as well.
Okay, good morning, Chair Black and Board of Health members. I'm here to present the collective bargaining agreement between SNHD and SEIU. I will go over a couple of highlights. Article 20, wages, a general increase of 5% effective July 1st, 2026. Effective July 1st to 27, a general increase of 3.5%. Both parties agreed to a wage reopener for the sole purpose of discussing wages in the beginning of calendar year 2028 to be effective July 1st of 28. Article 26, sick leave accrual shall be earned at the following basis: 0 to 8 years, 96 hours per calendar year. Over 8 years would be 120 hours per calendar year. Article 20, under bereavement, we added paw paternity, which allows our employees to utilize 2 days of sick or other accrued leave for the purposes of time to grieve the process for the loss of a pet. Under Article 33, educational leave and tuition reimbursement, the tuition reimbursement has been increased to a maximum of $52.50 per calendar year. We also added trade certificate courses that are now eligible for up to $2,500 per program. We did agree to a new article, Article 42, paid paternal leave. Eligible employees may receive up to 80 hours of continuous paid paternal leave in the rolling 12 months following the birth of a child, a placement of a child through adoption, a placement of a child through foster care. I want to thank both SEIU and SNHD negotiation teams for their dedication and hard work through the process. After just 7 meetings, we were able to come to an agreement. We appreciate the collaborative efforts of everyone involved and look forward to continuing to work to support our employees and the district. And I stand for any questions.
Thank you. Before we go to any questions, Jason or Sandy, would you like to share any comments or feedback for us?
Yeah, good morning. So our members overwhelmingly support this tentative agreement. Would like to say that this new agreement is a win-win for our members and for the district because we continue to prioritize the recruitment and retention of employees so that we can provide the highest quality care to our community. We also believe, and I think it was important to note what Renee said, I think this is probably one of the first public employers to make a commitment on the paid parental leave. And there's no place that should be one of the first ones than the health district who has committed that work for new parents in our community. We want to thank Dr. Lockett for his leadership in working with our union and really his commitment and value and respect for the employees at SNHD. And we've seen that not just in negotiations, but since the time that we've been working together. We also want to thank the management team along with Teddy and Mahogany for working together through some really tough issues, and we made it happen. I also want to recognize the folks behind in the first 2 rows, I think, here, our bargaining team, 15 member leaders who are committed to bringing forward these issues for discussion. And as you can see, most are here in support today. I'd like to introduce Sandy, who's a member of our bargaining team, to say a few words.
Hello. So I failed to mention I am a steward with SEIU as well. And on behalf of the membership, I can honestly say thank you very much to especially Dr. Lockett, who we know he loves his employees. He cares for his team, and he shows that. So we just want to say thank you to management, of course, legal, both sides, and the board. Thank you very much. And on behalf of the membership, I've been hearing a lot of people are very pleasantly surprised. We're getting a lot of great job, kudos, woohoos, and membership is happy. So, especially times are a bit, tough right now, and people were expecting less. And when they saw the numbers, they were just ecstatic. So very, very happy employees right now. Thank you.
Thank you all so much. So I would just say that to the point that Sandy just made, what we're doing here, what we're contemplating is an investment in our largest and most important asset, and that's the people that do the work. So it's not a giveaway. It's tied to return on investment. And there's a tremendous return on investment that comes from the body of people that work here to serve our community. We heard about that at the beginning of our meeting today, 2 weeks of dedicated work above and beyond just to make a difference and an impact in the public health of our community. So I'll turn it over to the board for any comments, questions for our staff, Dr. Lockett, or our partners at SEIU. Dr. Larson.
I just wanted to reiterate, thank you very much for your team and the hard work that you do. We see it, we feel it, and we're very appreciative. Thank you.
Councilwoman.
It's good to see a lot of familiar faces from SEIU. I'm a retired SEIU. And to the ladies who are retiring, it's a good job. It's a great job. It's just wonderful to see an organization and the people work together. None of this work that we have to do, none of the innovation, none of the community gatherings that show our community how to better care for themselves. None of this work is done without people. And I think our chair nailed it on the head. When we invest in people, they come to work happier, they do their jobs better. They're not afraid to innovate because they know someone is watching and is going to bring them up to the front and tell them thank you on a regular basis. And this is our thank you, that we see you and we are grateful for what you do. And congratulations to all of us. I think we're all going to benefit, and keep up the good work.
Commissioner Kirkpatrick.
Thank you, Mr. Chair. I'm prepared to make a motion because I feel like this is the first time that we haven't gone down to the wire on deadlines. So let's get her done, right? I think you and I have been in those hard meetings. So with that, I'd make a motion for approval.
Second.
We have a motion and a second. All in favor say aye.
Aye.
Any of-
Aye.
That passes unanimously. Thank you all so very much.
Thank you.
Now we will move on to report, discussion, action. Category number 8 on our agenda. Number 1, receive, discuss, and approve at-large members for the Southern Nevada District Board of Health and Public Health Advisory Board. So what we have before us today is the makeup of our board, as you know, is made up of elected officials as well as 3 strategically appointed at-large members from our community representing very important segments of our economy and industry, medical, gaming, and non-gaming business regulated by the health district. So we have, number 1, the perspectives and the value that these 3 at-large members bring to our board is invaluable. They bring perspective, insight, and expertise that helps us as a collective board to navigate the nuances of our unique community. And so what we'll do is we have 3 categories, as I mentioned. There are individuals that are already on the board. The 3 have applied to stick with us if that would be the desire of the elected officials that are the voting members in this particular agenda item. And then there are some other individuals that have expressed interest and applied for these positions as well. And we're very grateful for that. Just the fact that there are people interested in serving in this capacity means a great deal. So at this time, what we will do is we will go through the 3 categories, the physician position. And so before we proceed, just for a point of clarification, Heather, once we've heard from the applicants, both the existing members and the other folks that would like to be considered, we will allocate up to 2 minutes for each individual to state their reasons why to stay and or to be considered. And then once we complete that, when it comes to the board for a vote, do we do all 3 in one motion, or do we do them separately, or what's the recommendation from our legal team for clarity and transparency?
Thank you for the question. It is up to you. If you think that there is going to be votes on either side, you can call them one by one. If
Okay.
you think you want to do it as a panel and nominate one person per seat is available, you can do that as well.
Okay. All right. So with that, we will go to the first category, physician. Dr. Frank Nemec is a member of our board in the at-large capacity representing the medical. And I'll just turn the time over to Dr. Nemec for his reasons why he wants to do this to himself for another few years.
Thank you, Chair. You have my CV and application before you, so rather than go through all of that, I just want to touch on what changes there's been since my last appointment or reappointment 2 years ago. The first is I became recertified in infection control and epidemiology, and the domains of that certification include food safety, epidemiology, disease surveillance, infection prevention, occupational health, and cleaning, disinfection, and reprocessing of medical equipment. The second is my appointment to the clinical faculty at UNLV, the Kirk Kerkorian School of Medicine. And in that capacity, I've been working with the health district on a GME physician retention survey to look at what components are preventing doctors from staying in Nevada. The Lindsay Institute just published a article, a survey that shows that we're only keeping half of the residents that complete training here in Nevada. And, we're not spending this money to train doctors for other communities. We need to grow our.
Did we reach 2 minutes? Oh, sorry. Okay, sorry. I thought she was giving me the signal. I can listen to Dr. Nemec all day, I guess. I don't know. So
Well,
keep us
I will
on track,
speed this
Andrea.
up.
Thank you.
And 81% of people seeking fellowship training leave the state. So we are working with a survey that I'm working with 3 of the medical students at UNLV, Dr. Lockett, Dr. Mangla, and Dr. Ashraf, to complete this study so that we can send this information to the Nevada Health Authority that will ultimately be allocating that funding in the most effective way to keep the doctors here. Thank you.
Thank you. Okay, so we'll hear from each applicant, and then I'll open it up to the board for any comments or questions regarding the folks that are interested in these positions, if that's okay. So now we'd like to hear from Dr. Jose Partida Corona. Is he online?
Dr. Corona is not online.
Okay. All right. Now we'll go. Any comments or questions for Dr. Nemec from the board? Okay, thank you. So now we'll go to the second category, non-gaming business or industry. We have 2 applicants, Harley Ahmad and Babette Bond. Babette, if turn the floor over to you for 2 minutes to share your perspectives on your position on this board.
Thank you.
There you go.
You got me? Yeah. Okay, thank you. Don't start the clock. Technical issues. Thanks for the opportunity. I've been on the board here for 6 years, but I really wanted to use this opportunity to comment on my role in the industry, which I think there's been some questions. I'm very aligned with Culinary Union because I work for the Culinary Health Fund, but the Culinary Health Fund is a employer-sponsored health plan. So our governance is half union leaders and then half industry leaders. So all of the work that we do, or I do in public policy, is industry-driven to protect the workforce, to ensure that we have adequate provider representation, to ensure that we have enough immunizations in this community. One of the things that the Culinary Health Fund does is we run 3.5 health centers. Our last one is opening on Tropicana next month. Those see thousands of patients a year. We issue more prescriptions than anybody else in the state. We're very involved in anything that has to do with provider and network adequacy, and we're very involved in safety. We're very involved in food handling. We're very involved in immunizations. It's been a pleasure to be part of this community for so long. I'm also chair and have been co-chair for 5 years of the Health Services Coalition. That's also an industry board. We have 300,000 members in 27 separate plans that come together to work on healthcare bargaining and the appropriate use of healthcare dollars to ensure our community has complete representation of all the healthcare capacity and needs that we have. So I feel like I'm representing the industry, and I wanted to say that because I've been told that I represent one union, and I just wanted to clarify that. So I appreciate the time.
Thank you, Ms. Bond. Is Harley Ahmad here?
Yes. Let me just unmute. Harley Ahmad, you're unmuted. You should be able to unmute yourself if you press *6.
Hello, can you hear me?
Yes.
Okay, thank you, Mr. Chair, and the rest of the members of the board. I'm here applying to be a part of the Southern Nevada Health District as an employee of the Vegas Chamber. We represent a large number of businesses that are regulated by the Health District, not limited to restaurants, health clubs, childcare facilities, and waste management. And we have a strong interest in representing the interests of these businesses, as well as personally, I have a strong interest in public health. Working in Nevada for the past 7 years and working with our members directly for the last 3 years, and seeing the different impacts that the regulations that the board issues affects those businesses. So as the representative of a large section of the business community and the largest number of businesses in the state of Nevada, I would like to humbly submit myself for your consideration.
Thank you, Mr. Ahmad. So at this point, I'll turn the time over to the elected official voting members of the board for any comments or questions for Ms. Bond or Mr. Ahmad. Seeing no questions, any questions? Oh, did you have one? Oh, yes, ma'am. Thank you.
Thank you. Mr. Ahmad, can you just give us a brief overview of your experience and participation in health-related activities in the community? Any boards or commissions that you participated in that have an intersection with the work that the health district does?
So this would be my first professional experience related to health. My background is in finance. I've worked in finance for 12 years, but this would be my first experience directly with health in a professional capacity.
Thank you, Mr. Ahmad. Any other questions from our board members that are joining us virtually? Hearing none. Okay, at this point, I think, oh, I'm sorry. We have one more category. How can I forget my friend Scott sitting right next to me? He's hiding in plain sight. That's what he does. So anyway, we have one more category. It's the gaming. So I'll turn 2 minutes over to Scott Nielsen. He's the only applicant, but we'd love to hear from him, his experience on the board, and also his perspectives on how we move this organization forward. Mr. Nielsen.
Thank you, Mr. Chair. I found out when I was practicing law a long time ago that the less I said, the better off my client was. And so I'm going to keep it very brief. But I want you to know, everyone knows my background, my CV and so forth. But I've worked in the gaming industry for over 30 years. I've now been a consultant in the gaming industry for 8 years. After that, I worked very closely with the Nevada Resort Association, have good relationships with most of the members of the Resort Association. I've enjoyed my experience. I've now been on this board for 10 years, probably. I've enjoyed my experience working with the Southern Nevada Health District and being part of this team. I really appreciate the important work that's done here by the very talented people that do that work. And so I would love to continue my relationship and continue to be on the board. Thank you.
Thank you, Mr. Nielsen. Any questions for Scott? Thank you. All right, so at this time, we have the 3 categories. We're going to treat them in one panel, one motion. We have, if a board member is prepared with a slate of 3, we have for physician, Dr. Frank Nemec, Dr. Jose Partida Corona, non-gaming, Mr. Harley Ahmad, and Ms. Babette Bond, gaming, Scott Nielsen. The chair will take a motion.
Mr. Chair, I'd make a motion that we approve Dr. Nemec, Ms. Babette Bond, and Scott Nielsen for the health district industry-related positions on the board.
Okay.
I second.
We have a motion and a second. All in favor, say aye.
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 Any
Aye.
opposition? Hearing no opposition, that passes unanimously. Thank you so much. Let's hear it for these 3 awesome at-large members.
Mr. Chair, I'd also, because I'm consistent, right? So last time when we did this, I always offered to the other candidates that may have participated that we have an advisory board, which oversees tons of our regulations, tons of things before they even get to us. And we struggle to find people to sit on that, and they really could do yeoman's work on that. So I just offer that we let our candidates know those other boards are available too.
Thank you for sharing that. That's a critically important board. And as a matter of fact, we'll go on to the second part of this agenda item, the Public Health Advisory Board. Also 3 positions on this board that we need to take care of today with an appointment. We have 1 applicant, physician, Dr. Kenneth Osgood, currently a member of the advisory board. Nurse category, 1 applicant, Dr. Susan Van Bew. And for EH and EH services, 2 applicants, Kristen Baird and Dr. Brian Labus. So we'll do the same format with these individuals if they're, none of them are present. So their fate is in our hands. All right. So are there any comments or questions that the staff or Dr. Lockett might be able to help the board with regarding these positions and these individuals since they're not present?
May I ask this question? I do, this is always hard for us, right? Because we just get paper and credentials don't really know what that means. I would like at least for somebody to come from both of these boards at some point in the next quarter to kind of tell us what they're working on, because they should be working through regulations, they should be working through other things, and then maybe that might help others apply or at least reach out. But get people, come to the meetings to see how they work, but it'd be nice to know what they are doing because they've been in place since I believe we wrote this legislation in 2011. So I'd be curious to know what they've been doing the last year.
Thank you, Marilyn. When we get to board reports, if you'll say that again, and I think that would be certainly a worthwhile thing for a future agenda item and perhaps something that we do on a regular basis. So we have connectivity with our advisory boards moving forward. So thank you for that. Okay, so is someone prepared to make a motion? We have
Mr. Chair.
Yes, sir.
Yes, I am here for what it's worth. I looked at Brian Labus, for instance, and back in the day when I was on the health district 20 some odd years ago, he obviously has even more experience now, and I'd be thrilled if he joined that advisory board. Thank you.
Okay, with that, since we only have one applicant for physician nurse, and you're making a motion for Dr. Labus, will you convert that into a 3-part motion to cover all 3 categories? Is that, if that's okay with the board? Okay.
So done.
Okay, so we have a motion on the floor for physician, Dr. Kenneth Osgood, nurse, Dr. Susan Van View, and EH Services, Dr. Brian Labus. Is there a second?
I'll second.
We have a second by Councilwoman Gallo. All in favor, say aye.
Aye. Aye.
The opposition, please say your name with the opposition. If you're online, hearing none, that passes unanimously, and we're grateful for the role that the Health Advisory Board does in our community. All right. So with that, as stated at the beginning of the meeting, we are going to thank you all for being here. Feel free to mill about out and have some snacks and immunizations if you need them. We're going to recess, go into closed session pursuant to NRS with our legal counsel. And then when we resume, we'll do the remainder of the agenda, which is some budgetary items, as well as health officer staff reports and presentations. So with that, this meeting is adjourned. We're going into closed session. Thank you all for being here this morning, especially our partners and friends at SEIU.
Mr.
Oh, it's
Chair?
recessed, not
Mr. Chair,
adjourned. We're in recess.
And
One of my favorite parts of school.
Mr. Chair, the members that are online will have to leave this link and rejoin the closed session link that was sent to them.
Okay, so we have 3 members online. If you'll do that now, join the closed session link, and then we'll have you rejoin the regular meeting once we resume this meeting. Thank you all.
Andrea, can you send me a link if this isn't working?
Yes, it's working. I can see you and I can hear you.
Thank you.
Thank
Thank
you.
you.
call this meeting back to order. Do we need to do roll call or are we good?
I think we should do.
Okay, let's do roll call. Thank you, Andrea. Just for fun. Okay, go ahead.
The only board that makes up the rules along the way.
Member
It's us.
Becker?
No.
Member Black?
Here.
Member Bond?
Here.
Member Bruni?
Present.
Member Gallo?
Here.
Member Hardy?
Here.
Member Kirkpatrick?
Here.
Member Larson? Member Nemec? Member Nielsen?
Here.
And Member Summers Armstrong. We do have quorum.
Wasn't that fun? Okay, so number 2, petition 33-26, approval of the augmentation to the Southern Nevada Health District FY 2026 budget. There comes DJ Whitaker, our CFO. Thank you for being here, and let's hear it.
Okay.
Yep.
I understand this will pick me up better. But this is going to work. Okay, so what I'm presenting today is the augmentation of the fiscal year 26 budget, which ends next week on June 30th. And so this is our augmentation is to adjust our appropriations in line with what we anticipate we will be using for the remainder of this year. So I'll go with the overview. We did discuss this at length yesterday for the details, but our cost allocation, why did I bring with that? The budget for our overview is this budget actually is a better, an improved position than the augmentation that we brought back in February. So some of that, what is contributing to that is under the staffing. We're projecting our staffing, so this would be approved positions at 868.2 compared to our augmented budget of 871.35. So what that means is that's the number of positions we have approved, but that's not the level of expenditures that we would have in the budget because we did have some vacant positions. And I'll get into that when we get down to the expenditure part. So our general fund revenues were projected at 122 million. It's a net decrease of 1 million from the first augmentation. And then in our special revenue funds, we're actually projected at 60 million, and that's an increase. And I will, in the subsequent slide, I'll go over what that entails. In our expenditures, general fund expenditures were projected at 112 million. That is a decrease of 9.6 million. And that is from, in our first augmentation, we had an over budget of expenditures. And with our vacancies, if you'll recall, we left the vacant positions in for that the remaining half year. And anything that we considered would be vacant through June 30th, we did remove that. That entailed about $4 million of that reduction. And then in our supplies, in both our primary preventive care and our FQHC, we had reductions for a total between the two of 6 million. The $3 million contingency still is included in this proposed augmentation, just in the event that we had anything unexpected that we didn't project forward. And then in our capital fund, we actually have a reduction in there. We had some projects that did not happen during the fiscal year. Our paving project is one of those, and that contributes quite a bit to that reduction. So again, overall, between the changes in revenue and expenditures that we're projecting, our fund balance will actually improve from the augmentation that we had before. And we have a subsequent slide related to that. And we include the organization chart. And then just very general, the details of the changes on the summary page from our February augmentation, which is the current approved budget, to the current, we're changing from 179.2 million to 182 million. And this does include both our general fund and our special revenue funds. And then this is a slide by division. Again, just the same dollar amounts, just the areas that generate those revenues. So the details on the revenue are grants. So we did increase in the grant area. We did get some grants that were not included in the first augmentation. And then we made the adjustments, our final adjustments for our State Public Health Fund and our SB 118 to make sure we have appropriation to cover all of the expenditures for those grants, those portions that end on June 30th. Then we did have the increases. We received the SHARP award, our state opioid response. And so that's adding new grants in and adjusting for other ones that caused that increase. One thing to note is we did leave the lab expansion grants in this activity, even though some of that activity would be deferred to fiscal year 27, depending on how that goes. But so those amounts are still in here. If there's no expenditures related to that, then that would come in that particular area. And again, our general fund decreased, our revenues did decrease related to mostly to the pharmacy revenue. And you'll see in a subsequent slide that we also had a reduction in our pharmacy expenditures. On the expense side, we will go from 184.5 million to 178 million, mostly comprised of the things I mentioned earlier with vacant positions, the salaries being taken out, as well as our reduction in supplies and services. Okay, and then this one again is just by the divisions. So here we have, again, just going over, we did have an increase in the special revenue fund related to the same grants. When we have a new grant, we have to put the revenue and the expense on. So this is just the other side of that revenue piece that we covered. And then again, our general fund expenditures, the salary, taxes, and benefits, that decreases related to $4 million. And that could be if we had turnover and we had positions that were open for a short period of time, but then we did have 62 positions that were originally in our budget that we did not fill. Dr. Lockett has mentioned that we have a hiring freeze, right? So we're very strategic about the positions that we are filling, and so that has generated a savings for us in this year's budget. Okay, and then this area in our discussions yesterday, when we covered this is by division, and this one excludes our indirects and cost allocation, and then the next page, if I can get it to, the next page includes. So what that means is the first page is the revenues and expenses related to just the direct expenses within a division. And this one actually includes the cost allocation, which there's an allocation of administrative expenditures, which include HR, IT, facilities, so the space that they occupy and the services that are provided by admin. So that's the difference between the two graphs. And from that, from yesterday's meeting, we came that I think the cost allocation and budget in general it's a lot to absorb, and so we're actually looking at, I think, a workshop that would be in person later in the year, and I think we may have landed on October to get that out in front before we do an augmentation for the FY27 budget, so there's more understanding before we roll into that. So okay, and then in our capital fund, we were budgeted at 3.3 million, and that reduction I mentioned on that summary page of about $1 million, that is taking out the resurface project. And so our efforts with this augmentation is to really align the budget with what our expectations are. And then we still did keep that $3 million contingency in, just to make sure that if we we happen to miss an expenditure, or we have an adjustment when we get to year end for our pharmacy inventory or something like that, that we have sufficient appropriation and avoid any audit findings that might come if we are short on our appropriations. And this chart just shows our personnel changes, and you can see we went from the 871.35 in our first augmentation, and then this proposed, it would be 868.2, so that's a reduction of 3.2. So we did have some temporary positions that moved off, and then I will say we have a change, the 16 in disease surveillance, that reduction, that was just a movement of a function from one to the other area. And as we noted yesterday, that change into administration, that's not a function that is part of our cost allocation. It's just within the organization chart. So that's why that move shows there. And then this is the net change we're anticipating in the general fund. So you can see, like I said earlier, that it is an improvement from the first augmentation. Our first augmentation is the middle column. So we would have been estimating that based on the activity at that point, that we would have wound up with a $56.8 million fund balance before the contingency. And now we're estimating that would be at $66.3 million. Again, that $10 million swing is the things we noted, that the over budget in our supplies, and then taking out all those vacancies that we did not fill during this last 6 months. And then I think Commissioner Kirkpatrick had asked for, I think the target fund balance that was established by the board is 16.67% was the last one that we saw. And so based on this information against the ending fund balance, the 63 million, our expenditures with transfers out and contingency, we would be at 51%, so well above the 16.67. But if we take into account the note I have there about unassigned fund balance, that is the portion of the fund balance. There's a gap between the 63 million and the 52. There are things in our fund balance that are not spendable, prepaid expenses. There's some restrictions in there. We have the emergency fund in there. So from our audit, I took the 54 million, that is what's actually in our audit as of last June 30, and took the same activity against that, we would wind up with an estimate of 52.2 million, and that would be at a 42% versus against the target of 16.67. So it is in excess of the amount. In our special revenue fund, technically the revenue and expense should match, so the fund balance, that's something we try to clear out. We may have rollover from prior years that don't clear out, and so we actually do try to bring that to zero. They should match. And then again, capital projects, this is the general fund funds the capital projects fund, and so the transfer that we budgeted for this past year did occur, so that the activity that we took out of the expenditure side will probably be something that we put in the next augmentation of the paving project, and that, because we didn't expend it here, but it will not require another transfer from general fund because the funds are already in our capital projects fund. I got there very quickly. Any questions? I can go back to any slides that you have questions on. I know we had a lot of conversation yesterday, so if there's anything lingering, I can.
Thank you, DJ. Before we go to comments or questions from the full board, I'd like to turn it over to Mr. Scott Nielsen. He is the chair of our finance committee. They met yesterday and had a lengthy and thorough discussion about these items. And so I'll just turn it over to him for any comments, questions he may have, and then we'll go to the rest of the board before we proceed to the recommended motion. Mr. Nielsen.
Thank you. Thank you, Mr. Chairman. Yes, we received this presentation as a Finance Committee. We had the opportunity to go through it in great detail, ask the questions that we needed to ask. And we voted as the Finance Committee to recommend that this board approve the fiscal year 2026 June budget augmentation.
Any other comments from any individuals online? If not, the chair will entertain a motion to approve the augmentation to the Southern Nevada Health District FY 2026 budget.
So moved.
So moved.
I'll
Second.
Wow, echoes. That's cool. Our new system is amazing. All right, we have a motion and a second. All in favor, say aye.
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 Any opposition? Hearing none, that passes. Thank you so much, DJ, and thanks to our Finance Committee for working through the details of our finances.
Mr. Chair, I
Yes,
just want to
ma'am.
reiterate, and I seen Councilwoman Armstrong's light on, so you got to
Oh, sorry,
look
I
that
didn't see
way.
your light. Okay.
I requested that DJ have another meeting with us before we have a secondary augmentation. So that this one, we're kind of under the gun to get it to the county, to get it to the state, but to relook at our budget and maybe some of these expenditures.
So we can recommend that during, maybe if you want to do that, Scott, during our board reports to have a finance budget workshop with the Finance Committee well in advance of our next augmentation. So he'll reiterate that in a moment. All right, number 3, receive, discuss, and approve Clark County's fiscal year 2027 budget pages, SNHD's Schedule B for Funds 7050, 7060, 7070, 7090, and Schedules F1, F2, and Fund 7620. DJ.
Okay, so the forms that you see behind this cover page are how the adopted budget that you approve gets submitted to the county to be included in their budget that goes to the state. And so when we present our budgets in March for adoption by this board, we only have an estimate of property tax at that point. And usually a week or two after you adopt the budget, they tell us what the final is. And so in the past, actually look back, last year, we actually had an adjustment of 2.2 million up. For this fiscal year 27 budget, which is what this is related to, we had a slight reduction of a little over $157,000. But I did want to point out that initially it was an increase from last year was actually a $3.8 million difference from the estimate. This year, the difference from fiscal year 26 to the fiscal year 27 was the 2.2 million. So that would have been a 5.4% increase. And this reduction brings that down to a 5% increase. It was still an increase. It's just that the estimate they gave us was slightly higher than what their final came in when they finalized. So this is, you can see that there's a property tax revision that is different from the final budget currently approved by the governing board that will be presented, and that's the county request that we bring that before you so that you approve that what was in your approved budget in March was slightly different, and this is what was actually the county actually submitted on our behalf as part of their budget. So it's just to really shore up that what's on the books as approved by this board is what was actually submitted. So it is a $157,000 difference, slightly lower. And then I think we had a question yesterday about how that is accommodated. In this particular budget, we had already included the $3 million contingency in the 27 budget. And so that this reduction would actually probably be absorbed within that already. So we've kind of accounted for that there might be a difference. So really it's just acknowledging that. And then the subsequent pages that shows up on, oh gosh, that's hard to see. It's in the Schedule B for Fund 7050. So it's the second number. It changed from 43,749,874 to 43,592,028. And so I think, okay, there.
All right, thank
And
you,
nothing
DJ.
else in the schedules changed.
Okay, thank you. So I'll turn it over to Mr. Nielsen, our Finance Committee Chair.
Thank you, Chair. Yes, This was the other matter that we considered in yesterday's Finance Committee meeting. And in order to comply with what the county requires, we recommend that the Finance Committee recommended this board approve the Clark County fiscal year 2027 budget pages as presented.
Comments or questions? Otherwise, the chair will entertain a motion.
So moved.
We have a motion and a second. All in favor, say aye.
Aye.
Any
Aye.
opposed? That passes. Thank you. Thank you, DJ.
Thank you.
All right. Now we'll go to number 9, board reports. Southern Nevada Health District Board of Health members may identify, comment on health district-related items or issues that we would like to have presentations or discussions at a future meeting. I know there was something earlier from Commissioner Kirkpatrick, but I don't remember what it was. Mr. Nielsen's going to make a recommendation, so we'll have him go first, and then any other thoughts or ideas from the other board members that we need to bring up.
Yes, yesterday we had an extensive discussion of a number of different items. We thought it would be very beneficial to have a workshop where the Finance Committee gets together, reviews a number of different items. We would, as a Finance Committee, I don't think it would be an official meeting, but we could invite other people to attend so that they can have the opportunity to kind of dive into some of these finance issues in more detail if they'd like.
Thank you. Anyone else? All right.
I guess it's ditto to whatever I said earlier, Andrea. I'd like to have that on the a board. Oh, I know what it was. The advisory boards to maybe come
Oh,
before
yes, the
us,
report
so-
on a frequency, to
Yeah.
have our advisory boards come before us. We can set the frequency of that, but I think that would be very, very worthwhile. You know, they make recommendations or they approve things that ultimately come to us, but just having that continuity and, you know, maybe even a joint meeting perhaps where we can, you know, just really lock arms and talk about the direction that we're heading with our district and under their advisement. So, all right. We'll move on now to number 10, health officer and staff reports. Dr. Lockett.
Okay,
thank you. Oh, yes, ma'am. I'm sorry. Go ahead.
Mr. Chairman.
Yes, ma'am.
We have some young people here to do a presentation for the youth.
Yep.
It's going to be underneath my report.
It's there. It's
Yeah.
the second one. Okay.
Yeah, our
Sounds
youth
good.
advisory council, we're so grateful that they're here. This is incredible.
I was going to ask if we could go to them first.
Okay.
So first, you have to suffer 5 minutes from me first. But so,
We can
and
do it.
I apologize about that. But so, first thing, you have my written report there. So I just want to give you all a brief update on West Nile virus. You probably heard the news yesterday that the health district mighty, small but really mighty surveillance team identified West Nile virus positive mosquito pools in 3 zip codes. And to date, 4 positive mosquito pools containing a total of 165 what we label as Culex mosquitoes were detected. In response to that, we are increasing surveillance activities by deploying additional mosquito traps. Right now with that small and mighty team around the affected areas, we don't have unlimited resources. But that's what we're doing to determine whether activity could be expanding and then eventually amplifying. So we have to pay attention to that. Following yesterday's rainfall across the valley, we are also reminding residents about standing water and to quickly try and eliminate that so we can reduce any kind of breeding habitats. And we encourage everyone listening to inspect their homes and properties and empty containers that hold water. It's very important, and eliminate any standing water that you see, and to help reduce mosquito populations which helps all of us decrease the risk of West Nile virus transmission. So that's first. The second thing I want to mention, I want to do another follow-up on Ebola, specifically the outbreak in the Sudan and also Democratic Republic of Congo and Uganda. As you already know, I mentioned this the last time, there's no vaccine, there's no licensed vaccine or therapeutics right now. Right now, as of a couple of days ago, the cases have increased significantly since the last time we talked. There's 1,094 confirmed cases, 277 deaths right now. And as of June the 24th in Uganda, they actually had another death over the weekend, bringing their total to 2. In the total cases, they had an additional one to 20 cases total. And one of the things I want to point out why this is important to keep in front of us all is that There's right now in DRC, Uganda, in that area specifically, inadequate contact tracing, and their water infrastructure is inadequate and is bringing about a lot of social challenges that are leading to rapid spread. So, on average, at least 50 cases are occurring a day or more. The good news is, even though there's underreporting right now, we do know that since this started in the DRC, may have increased from about 10 hospital or supportive care beds to over 500, which is really good news in case this becomes more widespread. And initially, if we go back 5 weeks to the beginning of the outbreak, they can only test for 30 a day. Now that's ramped up to about 2,000 a day across 9 labs. So significantly increase there. But yesterday, and this is the problem, right? A very good example. Yesterday, a French doctor working in the DRC tested positive for Ebola. So we have to really be vigilant there and continue to pay attention, especially if it spirals out of control. And that individual is a healthcare worker caring for an Ebola patient in the DRC. So it's a reminder how vulnerable our health workers are. Healthcare workers are comprised of about 83 cases in the DRC, but right now still the risk remains low in the U.S. and in Europe right now. One of the things I just want to talk about real quick is that, the 4 airports, I won't mention them, but right now CDC has funneled 4,108 passengers through those 4 airports since May of 21st. And one of the things I want to point out too is SNHD has been busy as well. We are conducting active symptom monitoring. The last time I was here was 3, but right now we're conducting active symptom monitoring of 15 travelers who returned from Uganda. 7 travelers already have completed their monitoring period, so they're done. So that's a total of 22 travelers that have been referred by CDC to SNHD. So I'll stop there, and I will bring on, as requested, we will have Christina Montgomery and one of the youth to give the Youth Advisory Council update, Lola, who's one of our employee Gabby's daughter.
Okay. Good morning. My name's Crystal Montgomery, and I serve as a health educator here at the Southern Nevada Health District. Today, we're going to be presenting about Spark, which is housed here at the Community Health Division of the Health Equity Department. So to better understand Spark, let's get started by reviewing our program goals and objectives. Oh, I do? Oh, I'm like, oh, I thought she was moving. Which one do I do? One? Okay. Oops, sorry, went too far back. All right, so to empower youth, so basically the goal of our program is to empower youth leaders in Clark County to use their voice and help shape a community with better health outcomes through participation in a public health and leadership development program, fostering community advocacy and bridging the gap between their perspectives and public health approaches here at SNHD. Our objectives were 1, to deliver a comprehensive overview of public health frameworks at SNHD and our infrastructure through structured workshops and representing program services across all 6 of our divisions. We also wanted to, number 2, enhance the professional leadership and capacities of council members by participating in professional and leadership development workshops. And 3, mobilize our youth council members to advocate for better health outcomes in our community by addressing key social drivers affecting them in Clark County. With the understanding of our program and goals, let's go ahead and move forward to our next slide, the program description. The Youth Advisory Program was created using the Positive Youth Development Framework. We created 13-lesson curriculum, delivering direct instruction, inquiry-based and cooperative learning, and a problem-based group project for the program. Our leadership modules develop the next generation of public health leaders through hands-on training and leadership on leadership, advocacy, communication, public speaking, collaboration, and so forth. Our public health education models really increase their knowledge about public health systems, health equity, health literacy, chronic disease prevention, and community health strategies. And we also had division presenters come to the workshops, and they were demonstrating high impact youth leadership pipeline and public health workforce development strategy through exposure to our divisions and our departments, while advancing our commitment as a district to community engagement, prevention, and health equity. And finally, we had orientation, a mid-year team building experience, and a graduation event to strengthen engagement, retention, and peer connection. Our program had 10 diverse participants that were from the ages of 14 to 17, from diverse backgrounds and different experiences, and they represented 9 high schools across the Clark County School District. Next slide. While the program description highlights what we accomplished, the CSN Time Is Now project demonstrates how the youth were able to apply the skills and the knowledge and the leadership that they learned to make an impact on the community. Here you'll see is our CSN Time Is Now. It was a youth-led tobacco-free campus campaign. The youth in our council, they reached about 2,000 CCSD students engaged across 9 high school, as well as staff that were finding out about the project as they were taking pictures. At our media day, they collected over 120 student support cards at CSN supporting a tobacco-free campus. While we had that event, it was featured in 7 media sources via print, radio, and television. And the youth-led campaign amplified the awareness of a tobacco-free campus across Clark County for CSN. Going forward for policy impact, the next steps are CSN leadership is currently in the process of drafting a tobacco-free policy. The SNHD Tobacco Control Program will provide TA assistance on that. Outreach events will continue across CSN campuses starting in the fall of this year, and former Spark YAC members are going to support future campaign efforts. The Time Is Now project really provided our Spark members with a valuable opportunity to apply their leadership and advocacy skills in a real-world setting. But to better understand this effectiveness of the program, we're going to review the program evaluation. So here you'll see that we measured youth engagement across 3 different domains throughout the year. We measured the effectiveness, so the feelings and attitudes that they had, the behavioral, the participant engagement, and the cognitive, which was their understanding and the knowledge gain. The surveys were completed after every workshop and program event that we had, including our orientation, mid-year team building experience, and graduation. The format of the surveys were tailored to each type of session that they had, whether it was a module and a presentation or just presentations or modules or the program event, and they remain consistent throughout the year. And they were also provided an opportunity every time to submit written feedback of each survey to let us know what they liked about it, what they didn't like. The feedback that we received indicated significant growth in the youth confidence over the course of the program, and they were able to report to us improvements in public speaking, advocacy, and decision making, and their willingness to step outside their comfort zone. And we tracked and collected and tracked the data from the beginning, midpoint, and the end, so we weren't just collecting it at the end of the program. All right, so next one. You'll see here, this is an example of our findings. Our findings indicate that we had strong engagement across all 3 domains. Participants had a positive experience and high levels of satisfaction and we increase their understanding of the content and the expectations over time. And while we saw this increase, we also reported growth in public speaking, advocacy, decision-making, and willingness to go outside their comfort zone, and that 100% of them supported continuation of Spark. A full program evaluation report is in development and will provide detailed findings. Now that we reviewed the program evaluation, we're going to talk about the impact the program had on us as an organization, the community, and the YAC members. For the community, it showed that we strengthened community health outcomes by engaging young people as advocates, and that it was in line with our public health goals, as well as emphasizing the youth as active contributors, not just participants. We had measurable community impact through the project, the CSN Time Is Now, which impacted thousands of students and generated widespread public awareness. For SNHD, we had the opportunity to have youth engagement, which ensured our public health programs and messaging are informed by youth perspectives and lived experience, and shows that we are trying to make informed decision based on those voices, and highlights community engagement and responsiveness, as well expand our youth by having our reach in the community by having youth ambassadors that were able to do peer-to-peer outreach. And then as for the YAC members, they were able to develop leadership skills, and so that they could show practical and transferable skills they can use in the future, as well as becoming the next future leaders and professionals. And also, it also showed how they can contribute to the public health workforce. So while the data demonstrates the impact, most powerful evidence is going to come directly from our youth here. So I want to introduce Lola. She's one of our council members, and she'd like to share her experience about being in the YAC.
Hi, good morning. My name is Lola Romero. I'm 17 years old, and I'm from Shadow Ridge High School going into my senior year. I joined Spark to learn about all the topics covered under the umbrella term public health, and I expected just that, a generalized definition of the term. But what we got was mentor testimonial every week from employees here in specific divisions, and we learned in depth how their roles impacted public health. Prior to Spark, I hesitated to speak up in groups. I was a very nervous public speaker, and I often chose to work alone. Getting to be a part of the Spark campaign gave me the confidence to do something like this today, as well as broaden my perspectives and helped me realize that everyone has unique perspectives to bring to the table, and youth can ignite change when we collaborate. So through Spark, I was able to apply what we had learned all year round to our community. In collaboration with the Office of Chronic Disease and Public Health Prevention, I educated students at my school about the dangers of tobacco use while lobbying for support to turn CSN into a tobacco-free campus. With that support, we then went to CSN Charleston and garnered CSN student support, which Crystal said we got about 120 support cards signed, not including the digital support we received. I believe youth voices matter in our community because we are able to see issues at the root when it comes to our schools and community, and we are able to spread that awareness to adults. Programs like Spark should continue because it gives students like me an opportunity to connect with peers from across Clark County who are like-minded with us, as well as connect with mentors in the industry. And it also gave me the opportunity to create change that I needed to see. But my journey isn't the only example of the impact Spark can have on the community, so I'd like to highlight some others with a short video.
So while we're waiting for that video, maybe we could ask a couple questions. That's technology at best, right? So, Mr. Chair, you mind?
All right, go for it, please. Thank you.
Thank you for your work and really.
All right, there's our video.
No, go ahead. Go ahead. Try to fill it. Technology. So one, thank you for your work. I believe in youth advisory committees because I think you guys do see a lot of what's going on. But let me ask you this. So I've been bringing up for a while. I see, and let me disclose, I'm a tobacco smoker, right? But we're seeing in the vapes in the schools, the marijuana, all the other stuff, not necessarily tobacco in the vapes. Are you guys seeing that, whether it's a charter school, a public school? I worry for our kids today that the marijuana today is, and I recently attended a funeral of a 19-year-old child that a marijuana vape ended his life, right? From the mental health component, the THC, all of that. So I'm super sensitive to it in our neighborhood. I live in your neighborhood, right? So, that's the message. I mean, are you hearing that? Are you seeing that? Is there a way that we can talk to them about, hey, look, back in the day, as an old person, I could say, marijuana is not the same. I never tried it. I don't claim to know anything about it, but back in the day, it was a very natural thing that grew. Today, it's full of synthetic stuff. It's full of all these other things. It's having a real impact. But how would we as a health district say to kids, because you can't say trust me because they don't trust you, but we see 11-year-old children using the vape because mom or dad have it and it's marijuana that's in it. And so I'm less worried about cigarettes, right? I'm worried about the popcorn lungs. I'm worried about the mental health. Is that a thing? I'm working on getting the data from the district of the kids that have been suspended at RPC. I know kids that went to private schools that 15 of the most influential people in town, their children, were expelled from the marijuana vapes. And so I'm curious.
Yeah, so I would definitely say that I think the way for us to discourage children from using these is just to continuously show the effects. And I would say social media is an amazing way to reach children these days, and like kids my age for sure. I see online campaigns all the time against smoking and vaping, and I do think vaping is more prevalent. So I think though not the only way we can stop it, but one of the major ways is just showing the constant effects and the data and statistics behind it.
So let me just dig down just a little bit because I think you could help us at the health district before school starts. Let me dig down. So when I was a kid, they used to show, and we didn't have social media, but they used to show your black lungs, right? That you would just, it's going to kill you. Your lungs are all black. What does that look like? Because I get in trouble. So I wear my water district hat. I get in trouble because they think I'm too aggressive in my campaign. What is a proper campaign on TikTok that would kind of make you think twice about it?
Personally, I believe that showing the images of like the black lungs and stuff is still effective because it can show the students this is what will happen to you. I believe that would probably be the most effective.
It wouldn't be about black lungs, but it would be something different. But okay, thank you. So appreciate that.
Is there a video? All right, let's do it.
It's very rare to see like programs like this be sent out like into the community. Public health, we're here to help the community, and I thought I'm just gonna apply, and I got accepted.
If programs like these didn't exist, then there wouldn't be any change.
It's something you've always known about. Public health, we're here to help the community, but you don't exactly know what goes on.
And my advisor told me about this wonderful opportunity to work locally with students.
I got to know a lot more about how public health affects our communities.
It gave me an opportunity to learn more about public health and stuff I haven't known before.
So now I have a better idea of what exactly it is.
before joining this program, I really didn't have a clear idea of what it is I wanted to do.
Like helped me connect with others.
Helped me not only learn what are the things that are affecting our community, but what we can do to help them.
What makes this program effective is that it gives the youth the opportunity to actually get a hands-on experience.
I felt like the students at my school were very involved. They felt like it was an issue that mattered to them.
I didn't know about how most of the Nevada higher education schools were already tobacco-free.
I feel like a lot of peer interaction and just peer influence comes from friends.
They've done an excellent job of being able to go out into their community, but also be able to having that peer-to-peer connection.
You feel more enticed, especially when someone close in your age group is supporting it as well.
This project has reached nearly 2,000 CCSD high school students, and then as well as reaching the CSN campus community during our outreach event.
Having the youth there and being part of that whole planning process it's really key for us.
It also gives them the opportunity to see what public health is about.
It has ignited a passion for public health in me. It's possible for me to see pathways or what direction to go through if I wanted to pursue a career in public health.
I would definitely lean more towards the public policy and helped me connect with others.
It's been great being able to watch the kids slowly gain confidence over the year.
If programs like these didn't exist, then there wouldn't be any change in our community.
Thank you so much to our members of the first ever Youth Advisory Council. Another round of applause.
That is really, does that conclude?
No,
Oh,
no.
sorry. Okay, there's more, but wait, there's more.
Oh no, I'm good. So yeah, that was just a video that our PIO created just to kind of highlight the experience. You could really get a glance into what that looked like. There's also this Youth Advisory Council book. We gave each one of the youth one of these books at the end of the program year for the graduation. And so they did receive that as well. So you can learn more about the 10 kids that we had in our program. This was the first time we've ever done this. So while it was our pilot year, we got a lot of best practices from it, as well as things we'd like to do in the future. The first thing is we had the youth voice in the program. And so they feel more engaged when they do have a say-so and they do get to use their voice. And it also builds authentic engagement, confidence, leadership, and sense of agency with the youth. We also gave them a real world experience and how to apply what they learned in the classroom, even when it was from how to select a doctor, how to find, what questions to ask, what to do, because that's something adults have a hard time doing. So we taught them that. And then we also addressed a lot of the access and equity barriers that we faced. We did in the beginning have bus passes, but that was a barrier for a lot of them to get here on time, especially with the way school ends, as well as, safety, using the bus system in the winter and so forth. And so we ended up being able to have rideshare vouchers with Teen Uber so that they could get here, and that helped increase engagement and getting them more hands-on experience. Next step, things we'd like to do in the future is more real world experience and expanding that by offering tours of the lab and possibly eventually in the future, and our facility here at one of our clinics and so forth, volunteer opportunities and community outreach. We also want to strengthen their advisory role, building a more formal youth advisory feedback loop and having them be able to give us direct feedback, and then incorporating more parental engagement for greater parent involvement and retention for youth participation. So thank you so much for your time and attention today. We appreciate you listening about and learning more about the SPARK program, and we welcome any questions you have.
Thank you, Crystal and Lola. This is incredible. Year one is amazing. I'd love to see a list of the schools that participated. I'd also like to see a plan for expansion. I don't know if 10 is nearly enough, but you have to start somewhere. And also, I'm hopeful that folks like Lola will continue to advocate and recruit so we can continue to expand our youth advisory impact in our schools. So thank you. This is really incredible. We'll start at the end with Dr. Larson, go to Councilwoman Summers Armstrong, and then work our way down the list.
Thank you very much for creating this council. This microphone is freaking me out, but I just wanted to say I see the awareness that it's created, the community engagement, the understanding, the leadership skills, the confidence, and thank you, Lola. You're a wonderful young lady with exemplary leadership skills. You couldn't tell at all that you didn't have the confidence. You are extraordinary. So I wanted to thank you.
Thank you very much.
And I also wanted to just give you your kudos. And for you and the other young people that are in this youth council, this is where leadership begins, right? You are learning from the ground up what it means to be a representative for your community, what it means to be a leader. You can be an elected official. Don't let anybody tell you that you can't. And it starts here, serving your community in a meaningful way. Listening is one of the first things that it takes. Action is what you all have exemplified. Choosing something that you can get behind and then putting your energy into a solution. That's all that leadership is, and it's amazing. I want to know, did you all create a social media presence? Do you have a TikTok, which I don't have yet, but an IG, a Facebook? I think those are things that we should support them in having. So whoever the team is, you all develop your team and do some consistent all year round stuff.
So we had originally intended on making a Instagram account just so that we could share all the student support that we were getting. It just got a little too froggy trying to coordinate between all 10 of us to like who would run it and who would post on it.
All right, so then next time, you guys are gonna have to set up a subcommittee, because that's, welcome to the committee of the committee, to do your social, because the things that you all did are amazing. And when you do those things and put it out there live, you will see that more of your peers are gonna wanna be hanging out with you because you're a great leader.
Thank you very much.
Awesome. Any other comments, questions? Commissioner Kirkpatrick?
I would just say, one, I don't lose your contact today because I want to still work with you because I think going into the school year we can do some good things. But I do want to say to staff that, you know, there's a teen 988 number, there's a teen mental health number that the state has. Maybe we, the health district, should create the teen Instagram and let them be our followers, right? So then they can pass it along, because it's social media is a way to communicate with people, and we should probably, right? Because then we can control the content as well. But maybe we create it and then maybe we have them be our followers. But I would ask you this, Lola, what's your thoughts of what if, instead of necessarily expanding it, but taking it to the next level? So what if I said, hey, maybe we could direct staff to say, you know what, the first pioneer group was amazing. Let's take them to the next step and bring in a secondary group of the basics. So then that way you could have somewhat of an advanced class where we could, because I do think that's when we take them to the lab, right? Because they already have a little bit of knowledge. That's when we take them through some of the hard issues that we're working on. What would be would that be something in your senior year that you could take on as a project or be interested in participating in?
Yeah, of course. That sounds really interesting. And I think it would be a really nice opportunity to help mentor the newer group who come in. That could definitely be a conversation we could have.
And then what about if you think if we you know, at the county, we do the SBI program, and I don't know if you guys participate in the SBI program, but maybe that's an opportunity the cities do. Maybe that's an opportunity where we could actually give them a stipend for showing up every day. But I do think we should ask this group what is the next level for them, because we want to keep them engaged. And Listen, I heard a couple kids talk about epidemiology. Those are so hard to find. Those are other things. And if you're interested, and please, I want to stay in contact because I'm worried about this vaping thing going into school. And we also got to talk about heat, right? So it would be helpful for us to work together. So thank you for what you did. Thanks for passing along. This is great, but know that you're a pioneer. So we can only go up and we need your input.
Yes, thank you very much.
Thank you. Councilwoman Gallo.
This is really exciting and very interesting, and thank you so much for being here for this presentation. I'm out in Mesquite, and I'm on the Community Education Advisory Board, and I meet with the principals once a quarter or so, and I'm wondering if there's some way that this can be extended or copied. Is there a contact person that I would be able to contact to maybe develop this out and move it out more towards the more rural markets?
Well, it is for all of Clark County, so we do put out recruiting to all the schools within Clark County. And we've had it was essentially at first virtual, but then the youth expressed an importance in having, some hands-on experience coming in and face-to-face. So then that's when we created it to have a few meetings in person. We're expanding our recruitment efforts to try to get more people to know about it. It was promoted within our HOSA groups, the clubs at the different high schools within Clark County. Yeah, you can definitely contact us, Patty. It's the Health Equity Department. My name's Crystal Montgomery. And we can decide how we can get it more out there to Mesquite, because I know we were trying to get it out more into the Clark County School District.
Great, thank you. I will be in touch.
I would also, if you would include Henderson in that, thank you.
Babette.
That was most of my question, is how could you expand? But specifically for you, do you have next thoughts? Do you have thoughts about what you'd like to do next if you weren't being fed thoughts by us before you came in here? Did you have your own thoughts about the next steps or the missing pieces?
I definitely did think that doing more of a mentorship program would be beneficial for the new group of the YAC committee. I think that would be really helpful for them to see what we did in the previous year and how they can also do that. So I think that would be a really good idea for us.
Thank you.
Thank you. I think that Lola and her awesome first year YAC members deserve a round of applause. Thank you. We look forward to the amazing things in the upcoming years of the Youth Advisory Council.
Thank you so much for
Keep the spark alive. Dr.
Thank you, Lola, and thank you, Crystal. Great job there, and round of applause, well deserved. And one of the things I just want to mention is that, yes, I agree with Commissioner Kirkpatrick. In the Youth Advisory committees I've worked on in other places, there is like a 2-year cohort. And then that more seniors, they stay on to actually do the mentoring. So Yola was spot on there. So that's great. Yes.
Now I'll jump in. We're pushing noon and some of my colleagues have a hard stop. So if we can condense, that would be fantastic. The time that we spent, the things leading up to this was time well spent, but now we're kind of up against the clock. Thank you.
Diving in right now. So next up is Alicia and Candace to give you the aquatic update of the Environmental Health Division.
For the record, my name is Alicia Mitchell, Southern Nevada Health District, and I am the Aquatic Health Supervisor for the East Office.
And my name is Candace Sterling. I'm the Aquatic Health Supervisor for the West Office.
And I just want to say, Mr. Chair, that you will be able to swim again because Carla has left us in very capable hands in the pool program. Or maybe now you'll want to submerge. Okay. I have to put on my glasses. We come before you today to provide you with an update for some valuable information and discussing recent upticks in wellness activities that we have been seeing across the valley, and it's now affecting aquatic health. Today, Candace will talk to you guys about the top imminent health hazard closures staff have encountered during the inspections over the years, in addition to providing an update on compiled data for submitted drain cover applications. We want to draw your attention to recent cold plunge boom, and we have affectionately named this year the year of the cold plunge, which has seen a reinsurgent, and it's prompting us to update the current regulations.
Okay, so jumping right in, just to call out a typo, this says it's the top 5 imminent health hazards. It's actually for the top 6. These are the violations that our inspectors are most commonly closing for when they're conducting inspections. The numbers cover 2023 up through the end of April 2026 and represent violations found at venues that are open for people to use, not violations found at venues that are already closed by management. So as you can see, by far our most common closure is for disinfectant. That can be high, that can be low, but it consistently ranks about a third of the violations that we find, so that's concerning for us. Our next most common is related to enclosures. This is most often found as gates or doors into a pool area that are not self-closing and self-latching, which means small kids could get in when they're unattended. That's usually about 20 to 25%. Broken drain covers lands around the 10% mark on average across the last few years. And then finishing out our top 6, we have closures for high cyanuric acid around 9%. High or low pH is around 7%, and then filtration and or disinfection systems being shut off or inoperable is around 3%. In summary, it's about these 6 represent about 90% of the closure violations that we find on average. So it's a fairly small subset of the number of closure violations that we actually have, but the fact that they are occurring so frequently in just a few categories means it will be easier for us to focus on outreach training and seeing if we can really drill into why these violations are happening at the rates they're happening and see if we can help facilities avoid these in the future. Touching on drain covers, so just a bit of background here. In May of 2021, national testing standards for drain covers were updated and manufacturers had to start, the standards were updated a little before that, but they took effect in 2021 and manufacturers had to start producing covers under these new standards that year. Sorry, forgot to update my page. The result of the change in testing standards was primarily that flow rates changed. Even though designs did not change, the covers themselves did not change, but their tested and certified flow rates went down pretty dramatically in some cases. And the impact for that was that a facility could not just do a direct replacement when they needed to reinstall a drain cover due to a breakage or it getting too old, because the flow rate now had to be evaluated. So they had to come through plan review for a remodel to make sure that the flow rate of the cover they wanted to put in was still compatible with the pumps they had associated with that cover. So from 2021, I didn't put the numbers on. I think we only had about 10 because it was really, really low. So starting in 2022, people are still largely unaware of what's going on, and there's still a fairly large supply of the old covers that are out in the market. So it's not hard for people to get replacements. They are still able to avoid the remodel largely. Starting in 2023, though, awareness is really starting to grow. People are having a harder time sourcing these old covers, and even when they can find them, they're paying more for them because people realize they've got a hold on the market. And then again, 24, 25, we're starting to really see this uptick. Awareness is out there. The old stash of drain covers is gone. We had a little moment where we saw fake covers out there. People were spray painting them, trying to make them look new, refurbishing them, which is completely not allowed. And so people are really starting to struggle now. If they do get closed, they can be closed for a couple of months just because they're trying to come in usually at the height of season. And that's when our plan review office is the most closed, or is the busiest, and it's the most impactful time for them to be closed because it's hot, unfortunately. But currently for 2026, again, these numbers were around the end of April. Sorry, they couldn't be more current. We're still adapting to our new system. But if we stay on track for 2026, we'll probably exceed the number of remodels coming in this year that we did for the last year. And in total, we've gotten remodels for a little more than about 50% of our permitted venues. This doesn't mean that 50% have fully retrofit. We did have some where they would come in for one set of covers, but maybe not the other two that they had just because of their budget or what they were really focusing on at the time. But it is encouraging to see that we're probably getting close to that halfway mark, because the advantage to this is now that somebody has the new covers approved for use, if they do need to do a replacement, they can walk into any store in town, probably get it off the shelf, and they're not waiting for that remodel process or desperately searching Amazon trying to find an old one. So I'll hand it off to Alicia.
So cold plunges or cold spas, you may have heard of ice baths or cold water immersion. They can be in ground or above ground, as you see in the photos, single-use vessels as pictured, like the bathtub or a barrel type. Or you could have a multiple-use persons, which looks like a regular hot spa, but just cold. Water temperature is typically below 59 degrees. It's intended for submersion and not swimming, and it's usually for a short period of time, no more than 5 minutes, but typically around 1 to 2 minutes. They've increased in popularity in wellness and recovery service communities. We've seen them expand into gyms, health spas. We've seen mobile operations, and they are actually now in temporary event spaces. Are they safe? It depends on who you ask. If you ask the wellness community, a cold plunge is used to reduce inflammation, relieve muscle soreness, enhance muscle recovery, improve mental focus and resilience. But cold plunges can lead to several adverse effects, including cold water shock, drowning, skin nerve damage, numbness, and especially for those with pre-existing health conditions. Other physical risks would be frostbite. You can get infection, entrapment hazards, and injuries from slips and falls. As you can see from the thermometer, the colder the water gets, the more dangerous it becomes. We have noticed a lot of facilities out there that have been operating without valid permits. So we have gone out and we've been educating these facilities. There's wellness spas, fitness or float centers. They're selling the experience of saunas and cold plunges, a fire and ice experience. And so we are seeing, when we go in to provide education, common compliance issues, typically lack of permits. They didn't know that they needed them, inadequate circulation systems, lack of water quality monitoring methods, improper maintenance practices, or even unapproved retrofits of drain covers on a residential unit. We are seeing public health concerns. This is concerning to us. So we're wondering if they're going to get waterborne illness. Are they going to get sick from it? And are they operating safely? And how are they operating? So while we are working with these facilities to come into permitting and not stifle their business, they are still allowed to operate. They just have to operate under a drain and fill, which means that they simply empty and refill instead of continuously recirculating and filtering their water. So if they drain between each user and refill, then they are not required to have a permit. We do have operational concerns with that. Cleaning verification challenges, potential contamination between users, and inspection challenges that we are seeing as well is that limited maintenance records, delays in obtaining permits because they are trying to operate and they are okay with the drain and fill, and then they are not following their own operating plans that they themselves created. We are making every effort to work with facilities to find ways to allow for them to operate while they are going through the permitting process. So don't let them tell you differently. Temporary event cold plunges, we've seen them at EDC this last year. We have some wellness festivals going on. So they are popping up everywhere and they are becoming the norm because I guess Las Vegas is becoming a wellness community and I'm excited for that. So they too, we have regulatory concerns, limited permitting awareness, water supply and disposal issues because they are out and about. So where are they dumping their water? Where are they getting their water? Enforcement challenges that we have run into with is inconsistent disinfection practices. So do they have to meet the requirements of the spa regulations even though it's colder than a spa? And variability in setup. So no two are the same, so each one is going to present its own challenges case by case. So why update the regulations? Well, currently we have over 50 cold plunges that are permitted. If you see the pens to the left on the map, these are all new places that we have found and surveyed on social media nonetheless. And we have went out, provided education. We have approximately 28 in plan review, and more than 5 have been recently released from plan review. Cold plunge aquatic venues are not specifically addressed in the regulations, neither are temporary aquatic venues. So therefore, we would like to request your support in pursuit of updating the regulations in the upcoming years or 2. This will allow for the science behind these types of venues to be included within regulation. And can you believe it's been almost a decade since the adoption of the 2018 aquatic facility regulations? I cannot. We would like to thank you for your support and your time. Any questions?
Thank you so much. Any comments or questions? Who's ready for a cold plunge?
I know. It's cold in here, so I'm ready to go warm up.
Thank you,
Yes,
Mr.
ma'am.
Chair. I do support going to the regulations. I do think we need, I'm looking at this map, most of them are in unincorporated Clark County.
Mhm.
And most of these, I think we need to bring the sports community in because they're
Sports
kind of the
medicine,
ones that
trainers.
kind
Right.
of,
Most of them are already currently permitted. These are the ones that we found.
but I mean, maybe we need to bring them in to be on our side,
Yeah.
right?
Oh, very
Maybe
good.
we need to
Yes.
bring them in to talk about the
How to do it the
dangers
right way.
if they don't do it right. You know what I
Okay.
mean? So I
Very
do think
good.
that they have all these great little grants for community engagement, but it's different if a Max Crosby is telling Scott Black
Right.
that you're probably not doing it right. You know what I
Right.
mean? So
Okay.
we should utilize them when we can.
Very good advice. Thank you. Appreciate it.
Okay, so next, last presentation, Marco Mendez giving the EPI-8 update.
Coming hangry.
We all practice 10 minutes. I think he can get his done in 10 minutes.
All right, good afternoon. I know I'm standing between everybody and lunch, so I will get through this presentation. I just wanted to share some of the preliminary findings from the EPI-8 project that Chairman Black mentioned at the top of the meeting. For a little bit of context, EPI-8 projects are offered by the CDC Epidemic Intelligence Service. Local jurisdictions and state jurisdictions can request epidemiological support with pressing public health issues in their communities, and then CDC is able to deploy their Epidemic Intelligence Service officers to those communities to support those efforts. In our case, we haven't done one in Clark County before, so Dr. Lockett actually requested this support for this project that happened towards the end of May. So some of the rationale behind why we requested this, overdose deaths have been declining on a national level to the tune of 15.9% from 2024 to 25. Nevada also saw a decline, but not to the same magnitudes. It was about 2.2% reduction. So we wanted to use this project to learn more about how overdose is affecting our local community and how we can better tailor our efforts to hopefully increase that decline in the coming years. On the left here, we have a heat map of our overdose deaths. The brighter yellower areas are areas of higher burden of overdose deaths. So I'll highlight those are the downtown East Fremont area, historic West Side, UNLV area, and then the area kind of surrounding Valley View and Sahara. On the right, we have death rates by zip code, where darker shades indicate higher death rates. So those are 89101 and 104. For this study, primarily we want to use, as I mentioned, these findings to develop novel interventions and also refine our existing overdose prevention efforts, characterize our overdose trends for non-fatal and fatal overdoses here, learn more about the beliefs and behaviors among people at risk of overdose, and then identify barriers and facilitators for our local service providers in working with this population. So the data were all collected using semi-structured interviews. on a REDCap survey. These interviews were ranged from 30 to 60 minutes typically, so they were pretty in-depth. And we wanted to gather data from adults who've used substances within the past 6 months, and those are substances beyond alcohol and or marijuana. So if they've used, they could have used those, but if they've used something else beyond those are the folks we wanted to speak with. And our intent was really to get as representative a possible sample of as possible of Clark County, and ensure that the voices of our housed and unhoused community members were heard. We had a goal of getting 60 interviews in the 2 weeks we had, and towards the end of that, we had logged 69 interviews, so we did exceed our goal. And we did recruit our respondents from our hotspot areas. So as you can see here, this is the same heat map we looked at a couple slides ago. The white icons are where our recruitment and outreach efforts were occurring. So we definitely tried to use our data to inform our recruitment as much as possible. Some high-level demographics of our 69 respondents. So 55% were male, median age of 42 amongst this group, 46% unhoused and 52% housed. And then for the race and ethnicity categories, they're not mutually exclusive, so they will add up above 100%. We, in the final report, will be collapsing these to the Office of Management and Budget categories to match federal standards. And data cleaning and analyses are still ongoing. So housing status for one respondent was not cleanly determined at the time that these were generated. So that one respondent will not be reflected in the subsequent slides. So those will add up to 68 participants. So diving in a little bit among our unhoused respondents, majority reported living on the streets or alleys, followed by parks and couch surfing. And then there were other living situations that were indicated as well. Some examples are abandoned apartment units, empty storage units, sleeping on the bus, sleeping outside of a dentist's office. And then among our housed respondents, majority reported living in group homes and apartments. And those could include sober living facilities. So something important to note here is that living situations were anywhere that folks could have lived within the 30 days leading up to their survey. So they could have selected multiple options over the course of that 30 days. As we know, the housing situations for this population are typically very dynamic and can change rapidly. This just reflects the month leading up to their survey, where they may have lived, even if it was just for a day. Looking at our substances of choice from our respondents, that's the graph on the left. We can see methamphetamine, fentanyl, and cocaine were the 3 most commonly reported substances used by our sample. And that aligns with the overdose death rates by substance for the past 3 years. So you can see the top 3 there are also meth, fentanyl, and cocaine. So we did get a sample that reflects what we've been seeing in the data for the past few years. I'll also note on this slide that the fentanyl bar there on the right is a little bit higher. These are taken from decedents, so fentanyl may have been present in the whatever substance they were using, and it wouldn't have been known to the decedent at the time of use. Polysubstance use. So among our respondents who mentioned primarily using fentanyl, 95% of those also reported using methamphetamine. About 2/3 of our respondents believe that drugs are getting cut with fentanyl more often in the community, and about half reported polysubstance use and indicated a preference to use in isolation or to use by themselves, which we know is a risk factor for overdose. And then as far as awareness and response, about 70% or about 3/4 of our respondents indicated witnessing an overdose within the past year leading up to the survey. However, I'll note that 85% reported that naloxone was used in those situations. So it does indicate to us anyways that our current saturation efforts of getting naloxone out into the community are indeed getting it into the hands of folks that need it. 60% of respondents were also aware of the Nevada Good Samaritan law that passed a few years ago. And 52% of those respondents indicated that they trusted the protections of that law. And then I'll highlight the picture there in the center. It's a little hard to see. So that's one of our CDC officers who was part of this project, and they're actually taking a photo next to a discharged unit of naloxone that was discarded in one of the hotspot areas that we were recruiting in. So we know folks are using it. Looking at some of the qualitative findings, so these are from the interviews themselves. Most of them were voice recorded and transcribed, so we're able to pull themes out of those. So preliminarily among these respondents, there was a difference in perception of risk. So folks who primarily reported using meth perceived a lower risk of overdose than those who primarily use fentanyl as their substance of choice, as well as a dissonance in folks knowing that drugs are cut more often with fentanyl but still choosing to use, sort of highlighting the importance of fentanyl and xylazine testing strips. Methamphetamine is also seen as widely available, but at the same time considered weak and cheap by the community. And importantly, what I'd like to highlight is that the respondents felt prepared to respond to overdoses in their social circles and communities, and they're aware of naloxone and how to use it, which is great to hear. Now talking to our service provider organizations, they highlighted a continued need for wraparound services for this population, prioritizing housing, and they also impressed the importance of peer support in engaging this population in care and keeping them in care. So many of our service providers hire peers with lived experience. So next steps, these were all preliminary data, of course, so qualitative and quantitative analysis are continuing. They're underway, so we expect a full detailed report in about 4 to 6 months, which we would like to present once those are available. And then, of course, the detailed findings are going to guide our at SNHD's future interventions and refine our current ones. An example of that may be working with bus stops, around bus stops, as they are areas of respite from heat, but also places where drug use may be occurring. But we will know more once the final detailed report is available to us. And I would be remiss not to acknowledge all of our community partners without whom this data collection would not have been possible, as well as our CDC officers who deployed for this project, who are pictured here. Very thankful for their support in helping us make this project happen. Thank you for your time.
Thank you. Can I call you MGM?
Yes.
That's your initials, Marco G. Mendez. I like that. So any questions for Mr. MGM on this great project?
I will just say this, and Jessica knows well, the county is breaking ground, we think, in the fall on our 246-bed treatment center, which will have some housing that is not strained by insurance. Awesome. So we will be able to keep people as long as they need. So it's coming. It's coming. We know that it's coming.
Awesome.
So hopefully it'll be sooner rather than later.
Thank you.
Councilwoman Summers Armstrong.
Thank you so much for this work. I represent Ward 5, which includes the Corridor of Hope, which is one of your significant hotspots. And we want to see improvement for sure as we're trying to redevelop and reimagine historic West Las Vegas. This is a real inhibitor, and it's a challenge, right? But what we don't want is people not to know that there's hope and that there are people who care. And you going out, asking questions, helping inform how we move and what we do is super, super helpful. And I hope that you have found some of our people in the city who you can share this with, so that we can help, that we can be in partnership in moving forward with our own internal policies and the work that we're doing with the MORE team and the street teams. So thank you very much.
Awesome. Thank you.
Anything online? Any comments? Okay, thank
So
you.
how does the RTC get involved?
That would be something that we would explore in the future based off of what our finalized data look like. So not too sure how that networking or how that might happen. It may be that our data indicate that we perhaps should not focus as much work on the bus stops. It's just an example, but we'll definitely guide our future efforts with the data that we do receive.
Thank you. It looks like you have some of your teammates with you. Thank you for your great work and this life-saving and important effort in our community. So appreciate
For
it.
your continued support.
All right. Okay, does that conclude your presentation, Dr. Lockett?
That's it. Thank you.
All right, item number 11, informational items that are included. We'll move on to number 12, second public comment. Started with a full room down to a small group here, so thanks for hanging in there with us. Anyone like to speak during public comment? Seeing no one? Oh,
We do
yes,
have
we
one
do.
online.
Oh, okay. We have someone online. Go ahead and state your name for the record and let us know what's on your mind.
Good afternoon. Good afternoon, members of the board. My name is Laura Fussell, LauraFussell. I'm the program manager of employment services with Communication Services for the Deaf Inc., CSD for short, and thank you for the opportunity to make a public comment today. I commend your notable efforts in making the food handlers safety training card exam preparation materials available in nearly 30 different languages on your website. Southern Nevada is well known for its diversity. With how broad-reaching food service-related work represents in the service industries, it's very apparent the essential nature of your inclusion across these major populations. One population I don't see reflected in the list of languages your materials are translated for is that of the deaf community, those who primarily use American Sign Language. Estimates range from 38,000 to well over 100,000 deaf, hard of hearing, deaf-blind, and deaf-disabled Nevadans. Many of them are seeking employment in the food service and/or hospitality sector. Please consider removing the invisible barrier of language access to their entry into the workforce. Thank you.
Thank you so much, Laura, for your comments. We really appreciate you joining us today. Does that conclude our public comment?
Yes, there is no one else online for public
All right, we'll
comment.
close the public comment and adjourn this meeting. Thank you all.